of the above sort of talks about how to get care, or what kind of care you should seek. But that's assuming that access to care is available. And unfortunately, in the United States, that doesn't really seem to be the case. And I'm sure worldwide, it's also a significant problem. In my program in Washington, D.C., before I left, we had a several hundred patient waiting list just to get in the door because the demand was so high and the number of providers who were willing to treat the disease couldn't meet that demand. And that was in one of the biggest centers in the United States. But if you go to rural areas in the United States, they don't live anywhere close to a treatment program. So that's why telemedicine has taken off in the United States, mostly for adults. But of course, some of those programs didn't really have the medical supervision that they required. So some of the outcomes weren't so great. And then there was the whole issues with compounding pharmacy medications, which I'm not going to get into here. But there were just a lot of complexities to getting care that sort of, again, gave medical weight management a bad name. So it may take some work to find providers that can help, but I would urge anyone who's on this webinar to think about training themselves in the care of obesity or children with obesity or both, because there will be a need for that no matter where you work or where you live, and that need will be there for a long time. So yeah, reach out if you have interest, and I can help provide some input as to how to get trained and how to get comfortable taking care of patients with obesity, especially children with obesity. In the US, insurance barriers are still a huge problem. And in other countries, getting the national healthcare systems to provide obesity coverage can also be an issue, probably beyond the scope of this discussion and beyond what you can do as an individual provider, but just be aware that people are working on it. And there's the gray market, which is getting medications from outside of the country. And then there's self-pay in the United States. And there's the compounding medications, compounding pharmacies and compounded medications that may have impurities or may not actually contain enough active ingredient. So there are all these different issues that need to be sorted out. And it's really can be a lot for a patient and a lot for a provider. And, reform is needed. But again, that's probably beyond the scope of this current discussion. So lastly, where can we go from here? I think the message has to get out there to everyone that obesity is a disease worth treating, and that there are options that can address the disease fairly well. And those options include options for kids, and that there's no reason not to treat obesity. So if we can just normalize the discussion, I think that would go a long way. Talked about before that, supervision by specialists, especially if people are using telemedicine or other sources of getting medications, is critically important so that you can have appropriate oversight of what you're doing. But if we're ever going to scale, we really do need primary care providers to step up and treat the disease. I'll do the work on the insurance companies and trying to promote public health initiatives. You guys can help me in that effort if you want. But again, if you're just starting your training, I would recommend just starting with the patients first, and let some of the old hats like myself who've been doing it for 20 years go yell at the legislators and policymakers and all that stuff. But really just normalize the disease and the stigma. Talk about it with your patients in a compassionate and comprehensive way. Build trust, build relationships, and hopefully you'll change children's lives. So thanks so much for your attention today. And again, check me out on my website, www.obesityaction.com, or my YouTube channel, which is at Obesity Explained. You can hit me up on LinkedIn, on Instagram, wherever. Reach out, and I'm happy to help. So thank you so much for your time today, and hopefully this has been helpful.